All right, for this segment today, we're going to talk about how to give sedation medication to a child. First off, let's talk about the easy kids. There are some kids who'll drink our medicine if we ask them to. Those are the great ones, right? Those are the ones we can say, we'll give you a prize, or have mom help them, or we'll give them a drink after. And trying to get your kid to take the medicine as quick and fast as possible is the best way, of course. And so it's kind of your individual decision as far as how far you're going to push that, or let them go, or let mom help them in drinking the medicine. But ideally, we give the kids the medicine because we only have one good chance to do it, to give them that medicine, all right? If they spit some out, we don't get to put it back in, nor do we get to refill. So it's important to get our kids to take the medicine. We're not above using bribery or using coercion or whatever it takes to try and get that kid to drink their medicine. There are some kids, though, who just flat up refuse, and we know that we're not going to get it to go down. And so we're going to take a few minutes to demonstrate how to give medicine to a child who is being uncooperative. The first step, of course, is to explain to the parent what we're going to need to do, how we're going to give that medicine, explain to them what we're going to do and why we're going to do it, how important that medicine goes in, and that it stays in, and that if it comes back out, we can't really give more, so we got to do this in one really quick, concise way. Telling them, of course, that we know how to give medicine is a real important thing to do, and explain through all the steps. So we're going to go through the steps which you would explain to mom or dad, and then you're going to help them go through that whole process, okay? So we're going to make the assumption here, the little Olaf is my patient, all right, and we're going to be giving him the medicine. So ideally, it's good to have one of the parents sitting directly across from you. It's also good to have another assistant in the room to help you as you give medicine. You want to make sure your knees match up with the parent's knees and get your chair down so the kid can lay in as flat and their head tipped back position as possible, kind of like they're in the treatment chair. You also make sure you have gloves on, a mask on, and your cohort does as well. And then, of course, you want to have some extra paper towels and then a bib, all right? Because we're probably going to make a mess as we go through this process. So as you get everything ready, the other assistant has the suction, they'll hold the napkins, and you are going to be ready to give the medicine, and then the patient gets leaned back into your lap like this, okay? We do this in a knee-to-knee fashion, and you're going to give the medicine with your dominant hand, which is usually your right hand or left hand, I guess whatever it is, and use your other hand to help keep your fingers in a very specific position, and we give the medicine to the kid this way with their head back and kind of their head tipped up a little bit, and so they can swallow it and drink it down, okay? That's the position we're in, much like we do for a baby visit. Now, as far as actually giving this medication, you're going to see we already have it in the syringe. We're not going to give it all at once. We're going to actually give it in about 2 to 3 milliliters at a time. A couple, 3 or 4 just good pushes of the medicine. So you push 2 or 3 milliliters in and stop. 2 or 3 milliliters in and stop. And do a little bit at a time like that until the patient drinks all the medicine. That's about as much as the little kid can swallow, is about 3 milliliters. So don't give more than that, or else some of it's going to come back up or spill out the sides, okay? We also have this in place to catch it so it doesn't get all over you. And again, you want to have your mask up, your eye protection on, your gloves on, because there's a chance someone's going to come back at you, and you got to be able to be prepared for that, all right? Now we're going to switch places, so we're going to want to sit in the chair so I can show the hand hold and head hold for the patient during giving that medicine. So, let me sit in the chair, Juana. So again, both hands play a very critical role, and the other assistant is probably going to have to maybe even help support the head if possible. If your knees can't quite do it, help hold hands, whatever it might be, just so you can keep things under control. Because keeping that kid in this position, so they're not turned this way or this way, is really important. You got to keep it so gravity is pulling that medicine down, okay? So, now as far as things go, what you're going to do, let me grab my medicine here, all right? So because I'm right-handed, I'm going to take the medicine in my right hand, and it's going to slide in on the right-hand side. And you don't want it to go where their teeth are. You don't want them to bite on the syringe. You want it to slide around, and you want to tuck it behind their back teeth, way in the very back, okay? With your other hand, all right, what you're going to need to do is you're going to need to pinch the nose, all right? Finger, index finger, and thumb are going to do this, okay? Now, with one of your other fingers, your ring finger and middle finger, you're going to swoop in like this. That is the hold right there. Middle finger, holding that, and this keeps your lips. And why you want to keep the lips open is if a patient can close their lips, they can create pressure and they can spit the medicine back at you. But if you keep your finger in there, then they can't do that, all right? And you're going to slide this in, tuck it back. And of course, at this point, then you're going to start to give the medicine at a very specific time. They're probably going to be hollering. They're going to be upset. You can imagine if they're moving around, the other assistant might need to place their hand on the chin or something like that to get it. But what the big trick is at this point, once you've got this hold and got them in here, is you're going to wait for them to yell at you. They're going to yell and then take a breath, and then yell and take a breath. And what you want to do is you want to give the medicine, those 2 or 3 milliliters, at the end of their yell, right as they're running out of breath, yell, push medicine, and then right before they take the breath, they will swallow before they take that breath, okay? That's basically how it works. So again, it's a push medicine, push medicine, and they'll do this kind of gasping, swallowing thing, okay? So that's basically how we get the medicine down, and you can get it down in 3 or 4 pushes, and then it's all over with. Now, when the patient sits back up, what you're going to find out is in addition to swallowing the medicine, they also gulped some air, okay? And they're going to be hacking, and they're going to be acting like they're choking, and they could be very dramatic in all of this. And so it's important mom knows in advance that that's probably how they're going to act after. And then they will very likely burp a couple times because that air automatically will want to come back up and out. So if mom's aware that they're not throwing up, they're just burping up the rest of the air that they have, okay? And that's how we get through it. And of course, as soon as you got the medicine down, you let them get on mom's lap, you let them just cuddle, they sit, you reassure them, tell them how great job they did, you give them their prize, whatever you do to try and make that situation better. And then we're just waiting for the medicine to start to kick in. So that's how you go about giving medicine to a child who's uncooperative and helping them get through that whole process. And again, practice makes perfect. So make sure the first time you do this, you get someone who has experience helping you do it. And the first couple times, it might be a little tough, but then you'll figure out when that is, how to make that work really well. Thanks, everybody.